So I'm Dr. Jeremy Williams, one of the board-certified plastic surgeons here at Meadows Cosmetic Surgery. My training is specific in plastic surgery, which can become a really confusing concept for patients because we use terms like cosmetic surgery, plastic surgery, all interchangeably, and it can become confusing for patients as to who is really trained to do these procedures. To be a board-certified plastic surgeon, what it means is that you've completed prerequisite training in general surgery, which means there's been some surgical training of a general nature, and then there's additional training in plastic surgery, which includes cosmetic surgery, which would be cosmetic surgery of the face, body, breasts. It also includes a full spectrum of reconstructive surgery. In my instance, this surgical training consisted of 7 years of plastic surgery training. Woven into these 7 years was training in both general surgery for a couple of years, and the remaining years of that training were all plastic surgical training. My training was at Johns Hopkins University, which is in Baltimore, Maryland, and the training profile spanned 7 years. I did take 1 year off in the middle where I performed basic science research in the area of plastic surgery. It's important that you find a plastic surgeon who is trained in plastic surgery, not a physician who is doing plastic surgery. Examples of this might be a family practitioner who's doing plastic surgery in their office, or an oral and maxillofacial surgeon who's decided to do liposuction, or an obstetrician and gynecologist who decides that they also want to do liposuction. The difference in training is significant. Plastic surgeons have focused, on average, 5 to 7 years in dedicated plastic surgery training. It's also very important that your surgeon be board certified. This is how you know that they have met the criteria of the American Board of Plastic Surgeons and have passed a series of 2 exams, both a written and an oral exam, and go through regular maintenance of certification, which means on an annual basis, they're staying up to date with not only what is the most cutting-edge surgical procedure, but also all of the safety paradigms that allow us to make sure that patients don't get hurt doing these procedures.